Autism severity levels. When your child gets an autism spectrum disorder diagnosis, there is an avalanche of information. If you're looking to have your child assessed, here's a list of the ways you can get a diagnosis. What is the DSM-5? The DSM-5 is the fifth edition of the Diagnostic and Statistical Manual of Mental Disorders. The American Psychiatric Association released the DSM-5 in 2013. It is where a doctor or a psychologist finds the description and criteria for all of the disorders and behavioral conditions. As medical knowledge changes, the APA releases updated versions of the DSM. With the release of the DSM-5, one of the major changes to the autism section was the combining of the communication and social impairment criteria. Another change was adding the severity levels. What are the autism severity levels? One of the most confusing elements of a diagnosis is the severity levels. Instead of using a high and low functioning, which are ambiguous, we use the severity levels. Severity levels create a common language. This is important, so there is a standard, and we all know that we are talking about the same thing. There are 3 levels. Level 1 is equivalent to requiring support. Level 2 implies requiring substantial support. Level 3 denotes requiring very substantial support. A person can have different severity levels for each of the elements of autism. For example, a person can be level 1 in social communication, but level 2 in restrictive, repetitive behaviors. Requiring support. Level 1 ASD is the least severe. This could be viewed as mild autism. People who qualify as having level 1 ASD may struggle in social situations and have some concerns with restrictive or repetitive behaviors, but they only require minimal support to help them function in their day-to-day activities. At this level, it's tough to start or maintain contact with others, and someone like this might have few friends. It's also hard to plan ahead or switch from one activity to another. Requiring substantial support. Level 2 ASD is the middle range of autism in terms of severity of symptoms and needs for supports. The non-verbal behavior of people with level 2 ASD may be more atypical from the majority of their peers. They may not look at someone who is talking to them. They may not make much eye contact. They may not express emotions through tone of voice or through facial expressions in the same way that most other people do. Limited social interactions are common, and verbal and non-verbal communication skills are limited. Repetitive motions are noticed by others. Coping with change is difficult or impossible without these self-soothing acts. Requiring very substantial support. Level 3 ASD is the most severe form of autism spectrum disorder. People with level 3 ASD show significant difficulties with social communication and social skills. They also have restrictive or repetitive behaviors that often get in the way of functioning independently and successfully with everyday activities. Verbal skills are impaired, and it's tough to hold or sustain conversations with others. Repetitive and other challenging behaviors and inability to deal with change interfere with overall functioning. How are they used? The severity levels do not determine funding eligibility, but this might change as the province implements needs-based funding. Above all, individual assessments should inform treatment decision. Certainly, a therapist might use a severity level to pick which assessments to do.